And I know that you guys all want another 15 minutes from David, but you are stuck with me right now. So we can start the presentation. So my name is Eren Bali, and I'm the founder and CEO of Carbon Health. So, but most people know me from my Udemy experience, where we started a platform which let any expert to teach online. And it ended up becoming a very disruptive company in the education space. But a couple of years ago, my attention moved from education to healthcare. So my mom had a full body stroke, and I had to go back to Turkey to kind of to take care of her. But the stroke was not matching any of the common cause of stroke, right? So we were going from doctor to doctor to find a diagnosis. But luckily for me, so my sister is a nuclear medicine specialist. She's a doctor. So we perfectly organized all of her files, and we were seeing like several different doctors with a large pile of documents. And every doctor visit was pretty much the same thing, right? So the doctors would look at each page, and they would write 2 words to their notebook. And then at the end of, after looking at 200 pages or so, then they would take a look at their notebook and make a decision. So in our case, so eventually one of the doctors diagnosed her as a neurosarcoidosis case, which is not very common, and she was treated successfully. So she's back to normal. But meanwhile, like I'm watching this from the sideline. So my sister was running the show, so I was kind of comfortable. But I was thinking about how frightening it would be if I had to do the same thing, right? Because it was so inefficient to get the doctors to collaborate on giving care to a patient, especially in one of those more difficult situations. So what I did is, while waiting there, so I made a 1-page sketch about how I thought this experience should work, right? So I made a kind of complete intuition-based, no research. I was thinking that there should be something called a case, where it starts with the title of the patient, basic medical history, and then it should have a timeline of everything that happened to my mom across different practitioners. So by the way, this is not a time, I was not trying to start a company at all. I am still CEO of Udemy. We have 200, 300 people working, very successful company. But I was stuck there. Because I couldn't do anything else, I made this sketch of what I thought the healthcare system should work like. And my sister said that this would be amazing if it's how healthcare systems work, right? And then I had the misfortune of looking at how the tools that they were using currently. And then what I realized is that most of the medical record systems were not designed in the way that makes sense to the physicians. Because then my sister showed me a bunch of case journals where when the doctors communicate medical cases with each other, they have a format which is very similar to this one. But it takes a lot of work for them to prepare these cases in the conferences and present them. So what intuitively makes sense to doctor is very different than how the systems currently work. So this always reminds me of the story of 2 young fishes. So the 2 young fish just swim along in an ocean, and then they see another older fish, which is coming from the other direction. The old fish nods them and says, hey guys, how is the water today? So the young fish swim on, and they go a little bit more further. And then at one point, one of them looks at the other one and says, what the hell is water? So the issue is some of the most obvious problems are sometimes the hardest things to observe, particularly because you live with that problem for such a long time, you just confuse those with the reality, right? So what I decided to do is, okay, after a couple years after that event, so I decided to start a small team of engineers, designers, and doctors, and think about how care should be delivered by physicians. So we started doing a lot of research about it, and also a lot of sketches. And one of the big observations we made was the providers should not be storing medical records at all. So the medical records should be really a part of a patient's own data storage, right? The doctor should just merely be interfacing with the medical records you have, because an average person deals with a lot of doctors for a particularly important issue. And it's bizarre that every hospital, every clinic has their disjointed system of medical records, and they operate on this impartial picture. Instead, we decided to flip this logic altogether and keep all the medical records on the patient side, but give the physicians a tool to access those and kind of interface with those. So later on, we started looking at the kind of the healthcare system in more like a broader picture. And there are actually a lot of other problems around integration with labs, pharmacies, medical images. All this data is very complex, and it falls onto the patient to navigate this extremely complicated process. So, but in a completely different trend, at Udemy, I had the kind of fortune to observe how these two-sided marketplaces, with democratized access to services, disrupted education. By letting any expert teach online, we end up building the world's largest school. We have 60,000 teachers teaching you virtually anything that people want to learn. And the company is still extremely successful, so I'm still going on with the company. So we have more than 300 people right now. And then there were similar disruptions in other markets. So Airbnb was using the same two-sided marketplace to disrupt hospitality. And obviously, Uber is transforming transportation with, again, the same two-sided market approach. So I started thinking about, OK, what if we apply this approach we know that works, right, in a lot of this, especially these markets which are seemingly undisruptible. The network of suppliers, a network of supply with a really easy front end for the demand side has a very disruptive impact. So I started thinking about, OK, what would the world's largest healthcare network look like, right? So, and my answer was, it would definitely not be a large existing hospital chain which adds more and more buildings to their hospital network. So instead, we thought the world's largest healthcare network would be a ubiquitous technology platform which connects hundreds of thousands of doctors with their patients. Right? And in this case, you don't even actually have to employ the doctors. As long as you can provide a unified platform, just like Uber, Airbnb, like Udemy, and a lot of other companies did, you could actually create the world's largest connected network, and you could actually get millions of doctors to collaborate with each other without any problems. So, and we decided to just go build that, because honestly, I was initially, to be perfectly honest, looking for somebody to invest who wants to do that, but I couldn't find anybody who's foolish enough, so I decided to do it myself. So we end up building this platform, which has essentially two sides. There's a patient side. Both sides are fully mobile. Right? In the patient side, you schedule your appointments. You see all your medical records in your phone anytime you want. You have all your prescriptions, labs, even your medical images coming right to your phone. It is the experience that we want for ourselves. To be honest, for me, it was very obvious. So this is what all the patients already demand. The funny thing is, we have a bunch of patients who are kind of younger, and they're not very impressed from our platform, which surprises me, because when I talk to them, I realize that they just think this is how healthcare would be working anyways. They don't realize that this is it didn't work. They don't realize that we had to call different doctors to schedule appointments. They don't realize that we still receive paper invoices. So, and on the physician side, what they wanted was is a solution which reduces all the overhead, all the administrative overhead they have to deal with, so that they can really focus on their job. So we built this platform, really, there's 50% in each side. And what we did is, actually, I think I have a video on the next slide. Can we play the video? So we opened a small primary care practice in San Francisco to test this idea. What we did is essentially we designed the experience we want for both physicians and patients, and applied in a small group of 500 patients. So there are a lot of differences in what we are building. First of all, the medical records, as we described, is on the patient side, and we organize them in a much better way than how the current medical systems work. So all of your medical history is actually organized by these independent conditions you have. So if you have diabetes and a doctor wants to review your diabetes, they don't have to go through every single visit record you had and search for anything related to diabetes. Instead, there's a nice timeline. They click, they have everything, all the medications, images, labs, everything about that particular problem right in front of them. And we have an ontology of this data which is far more structured than how normal healthcare systems work. Because really, EHRs are currently designed for just billing and administration, right? Other than that, they're just a glorified note-taking application. Versus we implemented a very structured schema. And later on, as we are working on it, we realized that our patients wanted both in-person care and also virtual care. So we implemented a hybrid between those. A lot of patients come to us first for a physical check, and then when they do follow-ups, they do them virtually with the same doctor. Or sometimes it goes the other way. Sometimes they do a virtual appointment because they don't have time. But if the physician feels the need of an examination, then they come in person. So essentially, this hybrid between different modalities is working really well. And as a part of this, we also have a bot where you first start talking to the bot. The bot does the basic intake. If it's slightly more serious, we suggest a virtual care appointment. If it's even more serious, we suggest a physical appointment. So essentially, there's a very kind of seamless switch between different modalities of care. That has been extremely successful. And other hospitals actually have also proven the success of these hybrid models. But you actually want a platform which creates the continuity of the care while doing this, switching between different providers. So, and then right now, our first test is going really successful, and we are in the process of opening this to other practices. So we have roughly 20 practices in our first launch group. So by the end of the year, we will have more than 100,000 patients on our platform. So where essentially all their healthcare outpatient care services will be going from their smartphone. And we are deploying this to San Francisco, and we'll be deploying this to another city, like the other cities very quickly. And before you know it, in maybe 5 or 6 years, we are targeting to be a nationwide healthcare network, which is really patient-centric. So I think we still have some time. So I want to talk about, OK, what we are doing just broadly makes sense to physicians and patients. We know this right now. But what we are really doing is we are creating the fundamental infrastructure for the advancement of the healthcare. Because if you think about all the advancements we have in the clinical decision support systems and all the AI, the use of AI in the actual decision-making process, I think it feels like trying to build Uber on the feature phones. Because the core delivery of the care still relies on those kind of age-old platforms. And if you cannot change those platforms, most of the advanced won't be used. All those variable device data you are connecting, right? So it doesn't become useful until it goes all the way to your physician. And for it to go to your physician, there has to be a link in the healthcare system in the patient side. So what we do is really just infrastructure for these other more interesting things to work. And to my surprise, I was actually thinking a lot of those machine learning and AI improvements we will do will be coming much later. But even after 6 months of operation, we started building some of the machine learning logic just to kind of suggest doctors what to do in different conditions. Because our data is extremely structured, we are able to suggest the right prescription or lab result to the doctors roughly 80% of the time, even with a very small data set, because we actually control how the data intake is done. So, and in the future, I believe the healthcare system is going to be is not going to be just about maybe virtual care and in person. It's going to be a continuum between AI solving very basic problems, and then maybe if it cannot be solved that way, maybe there's an asynchronous review and a virtual care appointment, consultation with other doctors. So in maybe 5 to 6 years, if my mom had a similar issue, instead of spending a month and a lot of resources into visiting different doctors, we would have just one case that a lot of doctors can review very quickly. Maybe in less than a week, we could actually find a diagnosis. And similarly, every clinical interaction a doctor makes with a patient will be going to a massive repository of cases that any other physician can review to give the best care. So I think these are some of the possibilities that we want to kind of create the way for. So that's pretty much it.
Thank you, Eren.